Hey guys, and welcome to episode 249 of the OCDstories.com podcast. Now in this episode I interview Dr. Ivy Ruths, and in our chat I ask her about why she started working with people with OCD specifically, living by one's values, the therapeutic relationship, exposure and response prevention therapy, the importance of doing therapy homework, living with uncertainty, motivation in therapy, words of hope, and much, much more. And a quick shout out for our podcast partners, NoCD. NoCD Therapy matches you with a licensed therapist trained to treat OCD, offers a personalised treatment plan delivered through face-to-face video sessions. Between therapy sessions, you can use their therapeutic tools in the app 24/7, message your therapist, and learn what helps other people in their OCD peer community. To find out more, head to go.treatmyocd.com/the OCD stories or click the link in the episode description. So thank you as always to you guys for listening to the show. I deeply appreciate it. And thank you to Ivy for her time. And without further ado, here she is. On the podcast today, I have Dr. Ivy Ruths. Ivy is a licensed psychologist and licensed specialist in school psychology, specializing in treating anxiety, depressive, and OCD-related disorders. Welcome to the show, Ivy.
Thank you for having me.
It's good to have you here. And I always, when I get a therapist on, I always like to start with, what got them into therapy, doing therapy, that is, and why specifically OCD?
That's a great question. I think it wasn't my dream to treat OCD. I didn't really know what that was when I first started studying psychology. My very first, what piqued my interest was a high school course on psychology and the brain. And I was hooked after that. So I'd always wanted to be actually a pediatrician so that I could help kids, right? But math and science are not my favorite things, and so I found myself with in a psychology class that I fell in love with and realized I could do what I wanted to do. Being a psychologist, but I knew that was going to take a very long time. So I did that though. So undergrad psychology degree, went directly into graduate school, which was a little bit unusual. I think many of the people in my cohort had gotten to go experience life. So they had seen a little bit more than I had. And with OCD specifically, so in my program, we have to do externships. And I was an extern for Suzanne Mouton-Odom, Dr. Suzanne Mouton-Odom here in Houston, and she specializes in trick, and as a result sees a lot of people with OCD. So that was my first experience working with OCD. And it was just, once you get to work with OCD and actually do exposure and response prevention in person, it's very easy to get hooked. You see people get better, you are with people on this journey, and it's almost like a light bulb went off, and I was like, this is so rewarding, this is what I want to do. And it allows me to be creative, which is really important to me. And I've gotten, I can work with the youngest kids, 5, 6, 7, 8-year-olds, all the way into adulthood. So it's variety for me too. And it's just something that I just, stumbled upon and fell in love with. I don't have any previous experience with OCD at all.
Nice. No, thank you for sharing that. And you worked at OCD Houston Clinic as well, right?
I did, yes.
Yeah. What was it like working for a big sort of program or inpatient treatment facility?
Oh, I loved working at the Houston OCD program. I had actually applied to be a postdoc with Thruster, he ran the OCD program, and I didn't get that position actually. So I went off and I did my postdoc at DePelchin Children's Center, and was sitting in my office in February typing, and my phone rings there at the postdoc, and it was Thruster on the phone saying, I don't know what I was thinking. I made a mistake. I want you. I was like, okay. And so I went ahead and took that leap from a community center to the program. And what was really special about that program were the clinicians. Everyone's so committed to their work. And again, you see people get better. And it's a completely different experience when you get to have patients in residential treatment. Those are really severe cases, and you make such intense connections with those patients because of how long you see them and how often you see them throughout the week. That it was, I was only there for almost 3 years, but it's a really significant part of, I think, who I am as a clinician, getting that experience.
No, that's awesome. And yeah, what a great opportunity. So, like I said a minute ago, I pulled a couple of things off your website that I want to use as
Or
starting blocks. So the first thing you wrote, which I liked, was willingness and a commitment to living life in line with one's values instead of with one's fears or in response to life's difficulties is the key to coping with distressing emotions and uncertain situations. So my question on that then is, how do you bring sort of values into your therapy sessions, and how do you talk about values to people? Because although it seems like quite a simple concept at times, I think people can get lost with it.
yeah, absolutely. I think it does sound like a simple concept, just reading about it, but um, kind of identifying a patient's values always comes into play near the beginning of treatment, right? So even in the first session, that's usually what I'll give them for homework after their first session is kind of explaining what values are and then having them go home and really think on what is important to them. Everybody's values are different. There is no right value, there's no wrong value, but a value, we use that really as a motivator, right? Why am I willing to do this really hard work? And it's because I, value the time that I have with my family and I want that to be positive time. Or I value my relationship. I value my career. Some people value money, whatever it is that they value, that's really their why. And I use this not just with individuals with OCD, but I think it's important for everybody that I see and even in my own life, right? So I have to ask myself, what am I doing? Why am I doing this? And living in line with your values instead of your fears, I think it's a game changer, right? So our feelings are fleeting, our thoughts are fleeting, our behavior. I like to say our behavior is what makes up our life, because it's a series of, the only thing I have control of, series of actions that I actually have control of, and I can do whatever I want despite how I feel and despite what I'm thinking, right? And so that's how I kind of tie it back into your values. Are you doing something that is in line with one of these values that you've identified, or are you really letting the fear or the anxiety or the uncertainty control your actions and therefore, control what your life looks like?
Yeah, no, thank you. I really like that. I think with OCD as well, there's so much emotional turmoil that goes along with it and the thoughts. And it's easy to, especially when the anxiety is there, it's easy to buy into that and get attached with it and fused with the thoughts and the emotions. But kind of switching to values brings us into action. And that's really what we can control. Can't necessarily control how we feel, how we think, but we can control what we do.
Correct. Yeah. And so
Mhm.
we're working on those things, right? Sometimes we're working on what we think, in relation to, can I be successful? Can I engage with this treatment, right? So
Mhm.
there are the ways that we're kind of working on what we think, but yes, we're not in control of those thoughts. I'm only in control of what I do with my body. And so, I can make my life look how I want it to look. I can have this life, but I must do first. And I always say that first. You must do it. You must do the thing first before you feel like doing it, before you think you're capable of doing it. You have to actually do it.
Yeah. Yeah, I like that. Action precedes motivation. I often try and say to myself if I'm unmotivated, and sure enough,
Absolutely.
10 minutes later, I'm now inspired. But it took the action to get them. Not always the case. So I want a caveat, but
Yeah,
generally,
no, absolutely. And I tell kids that they have to prove it to themselves, right? So their brain is telling them one thing, but they
mm,
actually have the ability to prove to themselves what they're capable of, but they have to try it first. You
yeah,
actually have to do it. And then once they're in that, they're doing the action, then they
mm.
can see, oh, it's completely possible for me to do this. And now I'm willing to keep trying.
Yeah, no, absolutely. I like that. Getting them to be curious about it as well, and do the behavior to then, like a scientist, almost examine it. Yeah.
Very much we're detectives, where let's see what happens next.
Mm.
Let's see how it feels.
Nice. Okay, so the next thing I pulled on your website, pulled off your website, is the therapeutic relationship is of the utmost importance to me and to the effectiveness of treatment. Now, not too long ago, I did a whole episode on the therapeutic alliance and relationship. But yeah, I just wanted to ask you, like, why was it important for you to write this on your website?
That was important for me. I think personally that that's my strength.
Mm.
Um, I may not be the most organized note taker, and I may, let us get off topic in a session, or, whatever it is. But it's because I think what I'm really, really good at is that connection and that relationship. It's so important to me that somebody feels comfortable being who they are.
Yeah.
Um, that is the biggest step. I think being comfortable, being vulnerable with me is going to allow us to work together. To the relationship, this relationship is oftentimes, I've found the relationship is oftentimes why someone is willing to do something
Mm.
that I've asked them to do. And so it's really important to me that we establish that at the beginning. I spend a lot of time establishing rapport with kids, especially because that can be really difficult if I'm not quite understanding what I'm doing here, or, how this is really, how these behaviors are really interfering with my life and holding me back. I'm not going to be jumping at the idea of doing exposures. But if
Mm.
this person that I'm really connecting with, and that I kind of see as my coach or my guide, and I kind of use that a little bit to my advantage of
Yeah.
wanting someone, somebody wanting to please me, actually, to being able to get where they need to be in treatment.
Yeah.
Does that make sense?
It absolutely does. Yeah. I asked it because especially with CBT therapists, I don't see that written often on their websites about the therapeutic relationship, but we know from data it's a third of effectiveness of almost any therapy.
Yeah.
Yeah.
And I think that's just kind of my personality too,
Yeah.
which is hard for that not to come out in a session. It's beaten out of you in graduate school. You are supposed to be there, and you're a blank
Mm.
slate, and you have this unconditional positive regard, but you don't move around. So one of the things I always think about is we had to film our therapy sessions when we were in graduate school, and
Yeah.
sit around and watch them all together. And I would get so much criticism for moving around, right? You can see me, how
Mm.
much I've moved around already in this session. I'm supposed to be peaceful and sit quietly, and that's just not who I am, and that's not my authentic self. And so now, being a clinician for many years now, I am allowed to bring my, I feel I've allowed myself, I don't know, nobody's given me permission to bring my authentic self to a session, one that works really well with kids, if I am who I am, just kind of this, like, I want to know you, I want to
Yeah.
know who you are outside of this room. I want to know so much of your life. And I often share a lot about my life too. I know that's maybe also not a lot of CBT therapists might do that, especially if you're focusing just on ERP. But I think because I'm willing to go there with somebody and also share some of my own, issues, some of the things that make me anxious, some of the things that are hard for me, that I am better able to get somebody to kind of get on board
Yeah.
get on board with this, and this is beneficial for you. Be willing to do the hard thing.
Yeah. No, I absolutely agree. And the whole self-disclosure thing, I think I'm kind of pro it where it's needed. Like, I think it's a helpful tool, because you, like you said, you're building a relationship. It's a therapeutic relationship, but it's still a relationship.
Yeah.
And there's trust there when the therapist reveals a little bit of themselves.
Right. You're not going to, tell everybody your life
Yeah.
story, but there are times where it's relevant.
Yeah.
This is really hard. Even in a session when you are, I'm a human too, right? So I can and might be upset with something that has just happened, or, the way that you're reacting to something. And I think it's important for me to be able to express that too, so that it does feel, it's reflective of this being a real relationship with another human, even though I'm a therapist and we won't be friends after this, but, I genuinely care about you.
Yeah. Yeah. Important distinction. My next question was going to be, and you kind of answered it there, but it was around at what point do you bring, this is something I haven't really asked before on the podcast, but I think it's something I'll ask more, is around at what point do you bring ERP into the room? Some are like session 2, let's get straight into it. Others,
Mhm.
I'm sure, are a bit longer. For you, kind of,
Me personally,
yeah.
well, I do. So I'll spend the first session doing a lot of, obviously, assessment, intake,
Yeah.
those questions. But at this point, I'm always, I actually will talk about ERP at the very beginning. Even within that first session, I want people to know what they're signing up for. And so there's always a piece of psychoeducation where I do explain, this is what OCD is, obviously, and this is what ERP is. I need to know that you're willing to do these things before we keep going. Otherwise, there isn't really, we can get there eventually. And I always make sure, the caveat is we are going up, we're going up that staircase. I will never ask you to do anything that you don't want to do, that you're not ready to do. Like I'm never going to push you further than you're willing to go. It really is about you. This is what ERP looks like, but it's all you. It's you driven, right? It's client driven. But I'm definitely not shy about introducing that at the very beginning. I think it's only fair that somebody knows what they're signing up for.
Yeah, good point. Because especially, I mean, a lot of people that come to you, I'm sure, I don't know, maybe you could clear me up on this, but they probably know, if they've done research, that ERP is probably a part of it. But yeah, if they haven't, then it might be quite shocking for them in session 3 when you're getting them to face their fears.
A lot of people do know, and a lot of people know but aren't willing to accept that that's the answer.
Okay.
Right? So there's also some of that, like, well, I went to this other therapist and she said I had to do this, and I'm like, yeah, that is what it's going to look like. Or they have no idea, right? They've come to me from somebody who was doing thought stopping, and this is blowing their mind. But I think it's important that somebody knows what they're getting into, and just that there's no there's no right or wrong way to do it. And we're going to do it together, and it's going to be piece by piece by piece.
Yeah, no, I appreciate that. And sorry, go on.
I was going to say, and that they're not alone in it, I kind of frame it as you and I are a team, and we are going to get you through this sort of thing. And so your input is so valuable to me. I'm never going to make you do an exposure where you're just not for it. That's not beneficial to the relationship. It's not beneficial to your treatment.
Yeah. No, thank you. I agree. And my next question kind of leads on from that, is how, in that first session, and how do you, from a psychoeducational point of view, explain ERP to someone who, say, has no kind of understanding? And
for someone who has no understanding. So I kind of go through, I draw the OCD cycle every first session. I draw that OCD cycle, right? You know what I'm referring to? Like, so the anxiety, there's the obsession, the anxiety spikes, there's some faulty appraisal. I do the compulsion or the ritual to make the anxiety go down. And everyone's always like, yep, that's it. You've just explained how it works. And, 20 seconds later, I'm back in that cycle. And then we talk about, would you like to not be here? Would you like to feel free from having to do this compulsion? Yes. Okay, this is what that looks like. And I draw an arrow leaving that OCD cycle. And I say, okay, it's called ERP. It's the gold standard. And let me tell you what it looks like. And it's usually using an example of what they've just told me is, their fear, their obsession. And obviously that's going to make them anxious right then and there, right? And then we'll talk about what that might actually look like starting off. So we're not going to address any of those huge major things at the beginning. Maybe it's very small, and I show them how how we can create an exposure that they might actually be willing to do right then, right? And then I always, explaining habituation is a really important part of that explanation of ERP. It's everything, right? So I try to use analogies. The most common one is the swimming pool analogy. I use that with pretty much everybody. Should I explain that? Or
yeah, I just nodded, but then I'm like, actually, I'm not sure if I have heard it. So is it where you ease in to the swimming pool, or?
Well, no. So I actually say, so we have a lot of swimming pools here in Houston, right? It's super hot. And a lot of the times we're ready to get into the pool in March, right? And it's hot outside in March, but the water isn't hot yet. And we'll kind of suffer through it. We'll just get in anyway, because it feels like summer. So I'll say, think about the last time you jumped into a cold pool and you wanted to jump out immediately, right? That's often what people will do. Oh no, it's too cold, I'm going to get out. But what a lot of kids do, and teenagers, what we've learned is if you actually stay in the pool, your body just kind of gets used to it, and it's not so cold, So everyone's in the pool and they're just, come on, it's fine once you get in. It's fine once you get in, and that's exactly true, right? So once you stay in the water, you're fine in there, but the moment you come out, you're freezing again. And so instead of jumping back into the pool, jumping out, jumping in, let's just stay in the pool and see what that feels like. So sitting in an exposure, sitting in the middle of an exposure is being in that pool and letting my body get used to that cold feeling. And I'll explain, anxiety very much has a physiological component. There's only so long you can be so elevated. It's impossible to
Yeah.
stay at a 10 forever. You will come down, but you're not allowing yourself that opportunity. You haven't taught your body what it needs to learn, because you're always jumping out of the pool before you can prove it to yourself, before you know that you're capable.
Yeah, we kind of interfere with the process instead of letting our body almost, or brain, do what it wants to do to help itself.
And I really work at normalizing that for a person, right? Because we all want to jump out of the pool, right? It's human nature to not be uncomfortable. And so my office is usually pretty cold too. So I'll say, it's freezing in here and I have a sweater on because I don't want to be cold. I don't want to be uncomfortable. It makes sense why you don't want to be uncomfortable. But in this regard, you not being uncomfortable is limiting your life. You're not getting to live the way that you want to. And your days are passing, years are passing, and you're in the same place looking at the life that you want when you're completely capable of actually having that life.
Yeah, no, really important distinction. Yeah, no, thank you for explaining that. I love metaphors and analogies. I think they just bring it to life, for me at least, and I'm sure
Yes,
for
absolutely.
others listening. Yeah. So my next question was around homework. So, or between session work, if people don't like the term homework. How do you kind of encourage people to kind of stick to it? And because obviously a lot of the good stuff is done in that homework.
Yeah. And so that's a great question, because that's an explanation that I have during that first session too.
Cool.
So, we talk about, you're not going to come in here and lay on my couch and tell me, the problems that you've had this week. And that's not what this is. This is a working relationship. We're here to work, and we use this hour to get stuff done and to plan out how you're going to get stuff done on your own. And so we talk about how important it is for them to actually work on it at home. I'll say to kids, with the kids, I use a bunch of analogies, and they all play sports. So we've just talked about what their favorite sport is or whatever. And so I'll bring that back in and say, if you go to your coach, if you've missed practice for the past 2 weeks, and you go to your coach and you say, "Coach, put me in," your coach is going to say, "No, you're not ready. Sit on the bench." And so, and even if your coach did put you in, would you be any good? Right. And I always say, I don't really play sports. So I always say, I've never played baseball in my life. And if I went to your coach and said, "Put me in," and they gave me a try, I would be horrible at that. And so this is the exact same thing. Exposures have to be, it's your practice. And if you don't practice outside of session, you're not going to be any good at this. And, that works a lot for the kids, especially when we put in some motivation. So I talk to parents a lot about how you can motivate your kid to do a hard thing, because we all get rewarded for the hard work that we do. And kids, they really benefit from that praise and that reward, whatever it may be. So kind of keeping actual physical track. I think visuals are really, really important, not just for kids, but even grown-ups. I'll have the adults I see keep track in a chart, because it's so much easier to be like, look at everything I've done, look at everything I've accomplished, if I can see it on paper. And so I'll have them track their exposures and bring that back. But of course, not everyone's going to do homework, right? It's probably, I would say, like 50-50 that people are actually doing exposure work outside of session. And of course, the ones that do, they're getting better, and you can see a more rapid response. And the ones that don't, I always say, what? It's life, right? There's a reason. What's preventing you from doing this homework, right? What's getting in the way? And if we can't figure out how to do that, how to get over that roadblock, we're going to work extra hard in session, and maybe we see each other 2 times a week if this isn't something that you're able to do on your own. But then eventually, they get it, right? Eventually they get that if I invest into this, then I progress through treatment at a more rapid pace. And again, that goes back to your commitment and your willingness to be in treatment. Right? So if you're not committed to doing homework, then at some point, I have fired people before. I can't work harder than you. I always say that. I can't work harder than you at your treatment.
No, I think that's a really good point. And do you tell them, look, I'll fire you if you don't work hard enough?
Yeah.
Yeah,
I mean, I've had that conversation for sure, and there's a
yeah,
lot of, like motivational interviewing that'll
okay.
creep into those sessions, why are you here? Right.
Mm,
Yeah. It's a great fun. You get to come in and talk to me for 45 minutes, but, we're not getting any, if,
mm,
is this what you want to do? And I'll let a person decide for themselves too. Like, if this is what you want to do, then okay, but I'm going to remind you every single time that we haven't done this and we haven't done this and you're still in this place. You kind of try to put some fire under them.
yeah, annoy them into it.
Mhm.
Yeah,
Exactly.
cool. No, I appreciate it. Yeah, I mean, I always ask about homework recently because I mean, it is a key element, and a lot of people I think don't have good relationships with homework.
Mhm.
Maybe a lot's not fair, but definitely not in a minority. For me as a kid, I hated the word homework and anything to do with homework. And my relationships changed with that now, but like I think I want to kind of keep hammering that home because I'm sure, and I've experienced it with clients I've worked with. Sometimes they just don't want to do any homework, and you have, as you said, you have to have that discussion.
Yeah, I mean, that can be very frustrating. And I think wording it as practice for kids, I'll say
Yeah.
that kids are probably better at homework than adults are,
Mm.
right? Because they do have that external motivator of their parents' praise and the external reminder of their parents, hey, it's exposure time, right?
Yeah.
We told Dr. Ivy that we were going to work on this for 20 minutes every day, and I want you to be able to check it off. And again, the excitement they get from bringing it to me, and I'm like, oh my gosh,
Yeah.
you did your homework, you did your practice. So kids are a lot better at it, I think, than adults. um,
Yeah.
but it really, if you can get someone's partner involved, if you can
Mm.
get, adults that are living at home, if you can get a family member involved, I think that works really well.
Yeah, yeah, good point. I guess adults have, I don't say have more going on than kids, but they do have more responsibilities than children, and
Right.
it's probably easier to kind of push homework to a side. But yeah, I like what you said about bringing in family members or spouses or whatever to kind of. How would you kind of bring that up in session of like, I guess yeah, bring them in without it being invasive or
Hmm.
yeah,
So of course, so you're always going to ask. You need
yeah,
to have permission. How would it feel to? And I ask teenagers a lot, like, is it going to be annoying if your parents are reminding you to do this, or do you want them to remind you? And
mm,
they'll often say annoying, and we'll have to. Okay, so it will be annoying if they say it that way. What is one thing that your parent could do that might serve as a reminder for you that you have to agree? Right, you're agreeing here with me, and we'll talk to your mom about it later. But that you're going to agree that you're not going to, yell your head off at them, like you normally would when they are nagging you,
mm,
right? So we have to change the idea from nagging to being helpful. But a lot of work has to be done with parents sometimes too, because there is a lot of nagging going on sometimes, right?
yeah,
You want your child to be successful, and so it is, do this, do this, do this, and at some point that isn't helpful anymore, and it's just going to hurt your relationship.
yeah,
Um, so I think involving family members is extremely important depending on the age of the child or the teen. You can work that out with them. With a grown up, they have to be really willing to do that. And what comes to light a lot of those times is that those family members, that spouse, they're actually helping to maintain those OCD behaviors. We talk
mm,
about accommodation a lot. And once an individual is committed to their treatment and they understand how their partner is actually maintaining those, helping them maintain those behaviors, they're usually on board. Yeah, that's a really good idea. I know that I won't be able to do it on my own, so we should call them in. And then we'll have a joint, have a session where part of it's joint with their spouse, where we can explain, this is what we need you to do, and this is how you can say it so that it won't build resentment
yeah.
in that relationship.
Yeah, I appreciate that. And I do get a lot of family members listen to the podcast. So what are some of those accommodating mistakes, I'll call them, that naturally we make because we care, but isn't necessarily helpful for OCD recovery?
Oh my goodness. So there's so many, right? So this
Mm,
is part of what makes, part of what makes every person that comes in the door so unique is how the system around them is working. And that can be parents, and it can be coworkers, and it can be best friends. But what I see, I guess, probably the most is the reassurance that people provide to people that they love. Because naturally, if it's somebody that you care about, if it's a child, whether that child is grown or not, you don't want them to suffer. You don't want them to feel, to go through this really difficult time. And if it's really easy for you to do it, you'll just do it, right? So not only, we see a lot of avoidance in OCD, but we see a lot of avoidance in life. Like I said, we don't like to be uncomfortable. We don't like to be in pain. We've defined all of those emotions as bad emotions, whether you have OCD or not. So a partner that doesn't have OCD, or a parent that doesn't have OCD, a roommate that doesn't have OCD, doesn't want those feelings around them either. Right? We all have a lot of baggage to unpack when it comes to bad feelings. I call them just like difficult feelings, because there is no bad feeling.
Yeah.
And so really educating, I think, educating that family member, and in that role, I know that you care about this person so much. And so you don't want them to be sad, and you don't want them to be scared. And that's because you're compassionate and you have empathy and you care about this person. But here's what it's really doing. And so a lot of, every time you tell them that they're okay, and every time you tell them that it will be okay, first of all, that's not true. You don't know that. And second of all, this is what you're actually doing. And so with people who are giving a lot of reassurance, I think once they have that foundational knowledge of what that really is doing long term, it's easier for them to withhold that, that behavior that before would have signified I care about you, and that can feel really bad for them too, right? So if I'm not doing this thing that shows you that I care about you, that's hard for me. But we have a discussion about how hard is not bad, right? All aspects of this are hard, and that's not a bad thing, and this is why.
Yeah. No, thank you for that. Yeah. Anytime I can get advice for parents, to say lovers, but I guess that's still the case. Spouses, friends, whoever.
Yeah.
I think it's
Um,
good.
but I do think, the person has to be open to including them in the treatment.
Yeah.
And that partner also has to be open to really learning what it is, because they can make a lot of mistakes along the way if you
Yeah.
don't know what it is that you're fighting. If you don't know what the enemy is, you might invite that enemy in on accident.
Yeah, good point. Yeah, I was going to say, I guess from a parent point of view, the parents could learn about that reassurance seeking doesn't help them, and like stop reassuring them. But if the child or the adult isn't in collaboration with them, they'll start to be like, where's the reassurance gone? And that would be very unsettling if there's not that, I guess, mutual agreement of, you're not going
Yes.
to ask for reassurance, I'm not going to give it. Is that fair to say?
Exactly.
Yeah.
There has to be a conversation about this altogether beforehand. It can't be something that I talk about sneakily on the phone with a parent. Oh, from now on, don't do this. Absolutely not,
Yeah.
right? Everybody involved is going to know what it's going to look like
Mm.
beforehand. I can't be surprised that you're not providing reassurance anymore. That feels painful, right?
Yeah.
So I need to know how you're going to react. I mean, I'll even go as far as having parents, have a script. What is it that you're going to say? Because that can be really hard for a parent in the moment to just not give that reassurance. That's very difficult as a parent. And so I don't write a script down. This is the sentence that you're going to say. This is the only sentence that you're going to say, and you're only going to say it 5 times, right? So that there's a guideline. We feel a lot better when there's structure, and I know what I'm supposed to be doing rather than, again, right? So that helps me to kind of shape my behavior in line with my value as a parent, right? My value as a parent is to care for my child rather than my fear as a parent that my child is going to feel unloved or feel uncared for.
Yeah. Yeah. Really, really good point. So slightly different question now. Just any advice or your perspective on living with uncertainty?
Any advice?
Yeah.
Is that what you've asked?
Yeah.
Well, I think so. We'll go a little bit personal here. How about that?
Cool.
And I might regret saying all of this. We'll see. So when I started really focusing on OCD, I was getting a divorce. And that invited a lot of uncertainty into my own life.
Yeah.
Right. So, I mentioned that phone call with Thruster, earlier, right? So I'm, no joke, I'm sitting at my desk. I've just had a phone call about, yes, we're going to get a divorce. This is going to happen. And within the hour, Thruster called and said, I want you to do this. I want you for this job. And it was kind of like, what? And so they're really tied together for me, because my experience of uncertainty kind of paralleled me learning more and more about OCD, and how, so much of our human experience is not knowing.
Yeah.
But for a long time, um, that's how I kind of live my life. I think getting a divorce at the same time as becoming kind of an expert in OCD really was a mirror for me about how much I was actually operating under that the pretense of perfectionism or whatever, and control and planning and being organized. And now I had no idea what was going to happen, and so I can really relate to giving up all of that, false sense of control that I thought I had for my life, right? Because I'd planned it all out since I was in high school, right? That senior year psychology class, I'm going to go to undergrad, and then I'm going to go to graduate school, and then I'm going to get married, and then I'm going to have a kid, and it's going to work out, and I'm going to, my career is going to be great. And at that time, some of those things had happened, and a lot of them were falling apart. So this plan that I've had for so long, and it was going to be this way, and I was certain that it was going to be this way, and I was certain that it needed to be this way to be good, completely fell apart. And so it really paralleled me being able to relate to the intense feelings of uncertainty that somebody has during an exposure, or when they start treatment, right? Or when they meet me for the first time. And I think that, the whole experience obviously completely changed my life, but really made me a much better clinician, a much better, able to build that relationship. I think because it's relatable. I know I have given up that false sense of control, and that's exactly what somebody with OCD is doing. This
Yeah.
false sense of control that the rituals and the compulsions give you, even for just a moment of time, giving that up is extremely painful and extremely scary. And so, there's, when I'm trying to figure something out that hasn't happened yet, it really takes you away from any present moment. And I tell people all the time, what are you willing to give up today for, while you're trying to figure out what's going to happen tomorrow, that
Yeah.
may or may not come true.
Yeah.
Probably not going to come true. When I say, throw all your plans out, it never really works out that way.
Yeah.
That's not how life works. And so that's the way I kind of frame it, is, what you think about what you're giving up today, right now in this moment, in order to put all of your effort into something that hasn't happened yet, and something that you really don't have control over.
Hmm. Yeah. Well, thank you for sharing personally. I appreciate it. And I think what came to me that I thought was a teachable moment that I'd like to share is um, I think for anyone feeling like a therapist may not get me or may not understand what I'm going through, if they don't have OCD, they may not truly understand, but they get, as you've just said, uncertainty, and it was going through a divorce. I can't imagine it's probably unbearable at times,
Yeah.
and the anxiety that comes along with that uncertainty. So you're very familiar with those experiences. It just doesn't have the name OCD attached to it and the compulsive actions maybe, but
Exactly.
you still get the core emotional experience and pain. So I think that's reassuring for anyone who is maybe worrying about that. And then the other thing is, yeah, what a day, those two calls, like a roller coaster.
I mean, it was a huge, like, okay, like, it sounds like I'm supposed to do this, right? So, yeah, it was a very big day, and a very great day, actually, right? So, it completely changed my life.
Yeah, wow. Well, no, thank you again. So the next question is, has your view of treatment changed over the last 3 years? And if so, how? Or what have you learned, I guess?
What do you mean by my view of treatment?
Yeah, sorry. So just how you approach working with people with OCD. Is there anything you've added on or changed about the way you work with people?
Um, yes. So I guess you could say, when you start off, or when I started off, it was very strictly ERP, right? ERP, ERP, ERP is the
Mm.
only way. And that is actually quite hard for me because, again,
Yeah.
I am the kind of person that connects, and I want to know, more about you rather than just we're going to sign up, we're going to do an exposure. Um, and what I have learned from some of my colleagues, and I'm actually not certified in ACT and acceptance and commitment therapy
Mm.
at all, but many of the clinicians at the Houston OCD program are, and that was kind of their modality of choice, and they would bring that into their ERP sessions.
Mm.
And what's interesting is that I've done several presentations with some of these colleagues, and I'll say, well, I do that. I do that. I just don't have a name for it.
Yeah.
And I think that that's not something that is strictly taught to you when you're learning, this is what an exposure looks like. This is what
Mm.
response prevention looks like. This is behavioral therapy. And those, I would say that I've kind of brought into therapy that element of acceptance, of acceptance that, what, life is hard. This is hard. Things are hard. There are so many things that we can't change. And if you can just accept that, you can then take the next step. I often say to people that I think it's not accepting not accepting the hard part of your life that keeps you stuck. So that, to me, when you are not unwilling, because sometimes it's just, it feels impossible. It feels hard.
Yeah.
How can I accept this? But once you do, you can then start to make your actions line up with what it is that you want. But if you're spending all of your time pushing against what is, right, you have no energy left to do what you need to do in order to, even if that terrible thing exists and is true and is part of your life, you can do this and you can do this. So changing my perspective to understanding, like, I'll tell people all the time to use the word and instead of but, right? So I feel really, really scared, and I can do this thing. Right. So I'm
Yeah.
accepting that this is scary. I'm accepting that this is a mountain I have to climb, and I can do it. Right.
Yeah.
I can try.
Yeah. I love that. Yeah. Um, I am anxious and I can go do this thing I value.
Absolutely.
Yeah. I like that.
A lot of times the sentence ends with, I'm anxious and I don't want to be anxious. I don't want to
Mm.
be anxious. I don't want to be anxious. Okay, but you're spending all your effort trying not to be anxious, and guess what? You're still anxious. So let's be anxious and do the thing that lines up with your value at the same time.
Yeah. Yeah. Absolutely. Yeah. I love that. Um, and other than homework, or I should say, other than doing the homework, what do you notice in your clients that just seem to make progress much quicker than others?
Oh, that's a good question. Um, so willingness is very important,
Okay.
right? You almost have to be at the point where, it doesn't matter how hard it's going to be. I'm committed to it. And
Mm.
it's hard to say this without, I don't want to make, people feel bad, but at some point, I'll say to people that are really struggling that it's a decision. It's a decision. Life is not happening to you. You are making the decisions that, result in this happening and this happening. Yes, we're not in control of the overarching, what our life looks like, but you get to make decisions, right? By deciding not to practice your exposure, this is what's happening. By deciding that, you're going to believe pretty much the lie that the exposure will be too hard or that therapy is too hard, you are choosing to stay where you are, right? So at some point, you have to recognize that I am in charge of at least my body. I'm in charge of at least, what I'm willing to try. And if what I'm suggesting, right? If my therapist is suggesting is too much, then I'm at least in charge of saying that it's too much instead of just not coming back.
Yeah, I think, yeah, for some people that's probably like tough to hear, and for some people, as you know, it would just take some time for them to get there. But I think it's an empowering thing to be said, because OCD can often make you feel like you don't have a choice, and
Exactly.
that it's telling you what to do, and the emotion, and but I can't, I have to do this, or I have to do this compulsion. When in reality, I think, what you just said is kind of saying it may feel like you don't have a choice, but OCD
Yes.
can't control your limbs, it can't control where you go,
That's
you know?
exactly what it is,
Yeah.
right? So the hope is that that's an empowering statement to the person
Yeah.
rather than, help making them kind of shut down. And so you kind of gauge who you say that to, but
Mm.
that's sometimes that's what it comes to, right? And the moment that, somebody walks in the door and you can tell that they don't really want to be there, or that they're there because their wife made them, or they're there because their mom made them, I'll say it from the get-go. I don't know if this is going to work, you
Mm.
know especially to a parent of a teen or an adolescent that's dragging their kid there. Well, I'm going to let you know from the beginning that if your kid isn't the one making the decision to be here, this is going to be extremely difficult. And there, you loop back to why that relationship is so important, because it's with those patients, with those clients, that I really have to work on that relationship.
Yeah.
Because if the relationship's already kind of tarnished with their parent or whoever's making them come, then that's not going to be a motivating factor, right? I resent you right now. It's almost like, especially if you're a teen, I'm going to do the opposite of what you say. And so I have to use the relationship that that person has with me to see if they'll buy in. And if not, then maybe this isn't the right time. And that's okay. I have to help people understand that too. Like, it's okay if this isn't the right time. But that's my hope is always that they get the idea that, yeah, OCD has taken so much from you. They've taken so much of your life, and it does feel like you have to, right? When we talk about how it's not true. Exactly what you said, right? You are in charge of your limbs. Go do it. Go, but we'll do it together, right? I'll do it with you. We'll do exposures together. You're not alone in this, but you have to try.
Yeah, that's it. I think it tries such a powerful word. Like, I think we focus on winning and losing too much, and
Mhm.
actually trying is all that matters. And if you keep trying, you'll learn. Even if you quote unquote fail, if you
Yep.
learn from it and just keep trying, eventually you'll get to where you want to be.
Yep. And that,
Yeah.
that try is so important. And that's where, that's maybe the difference that I think you're asking me about. The people who are okay trying are going to be more successful than the people who think that, that just aren't willing to try. I don't want to go there. If I have a
Mm.
roadblock up and I'm not going to try, what are we doing here?
Yeah.
Right. So let's come back when you're ready to try.
Yeah, absolutely. And yeah, a valid point. Some people just, today may not be the right time, but 6 months from now might be go time, you
And
know?
and just because somebody's not willing to try right now doesn't mean, I'm going to kick you out of my office. Let's
No.
figure out what's stopping
Yeah.
you from trying, so that's a lot of
Mm.
work that goes into it too. So it can't just be exposure it can't just be
No. Yeah.
exposure work in treatment. If you're having somebody sit across from you and they're so afraid of trying, okay, let's go explore that. Let's delve into that. And again,
Mm.
that's why the relationship is so important, because that's a really vulnerable place to be where someone's being able to share with you why even trying is so difficult.
Yeah, valid point. And I do focus a lot on ERP on this podcast, but yeah, it's never just ERP.
Yeah, it can't be.
No, absolutely. And the key one that always comes to my mind is someone that came on and shared their story, and they said they spent about 2 months before even discussing ERP. They knew ERP was going to be part of it, but they spent 2 months working on compassion work,
Mhm.
because the client felt, because of the types of intrusive thoughts, she just felt like a terrible person, and she didn't feel like she was deserving of
Yep.
recovery in ERP. So yeah, it's a solid
I
2 months just on that.
absolutely, and I will say that is one of the things that I have seen the most.
Mm.
That inside, when you go deeper and deeper and deeper, that there's this feeling that I'm undeserving of this ideal, no, this life that I want, and I'm sitting here telling you that you're capable, and you're not quite there. You are capable, but you don't feel as if you deserve
Mm.
that. You don't deserve that freedom.
Yeah.
And if we haven't unpacked that, we're not going to get very far with
Yeah.
exposure work.
Yeah, really good point. Cool. Okay, so next question is words of hope for those with OCD. So just any words to.
Any words of hope? Um, I guess what I could say is, you know, having the experience of working with people who are suffering from OCD has been, it's given me hope as a not only as a clinician but as a person. I have seen people do so many hard things that it makes me believe that we're all capable of hard, right? That this is what has my work with OCD patients has been what has shown me that hard is not bad and that we're all capable of hard. I've gotten to see that. And so I would say, hard is not bad. You can do hard things. And that's kind of the mantra that I kind of wear around my neck in my own life. You can do hard things, and not to give up. And there's no right way to do a hard thing, but that trying is, what's going to open that door for you to this life that you actually do deserve.
Yeah, I like it.
Okay. I like it.
Yeah.
Okay, sentence.
No, I think it's a good point, and I think yes, we're focused on ERP again. It's kind of because it is, although there's much that goes around it, it's kind of the core, most effective part of.
Of course.
And it's a hard thing to face the things you're afraid of, and to kind of do the therapy anyway. And that is very symbolic or metaphorical for life. Of to do anything noteworthy, sometimes you have to go against massive rebellion and friction and roadblocks to achieve anything, so yeah, I think it's deeply inspiring, the people that listen to this show and that do that work.
I think
Yeah.
I think so hard is often, I see people run from hard things, even the little kids, right? Even my own daughter, right?
Yeah.
I can't do that. It's going to be hard. I'm not sure where this idea comes from, but I see it in even the smallest child, that you can't do hard. And so I spend a lot of time trying to help people understand you are 100% capable of hard. You can do hard.
Yeah, I love it. Let's get that in schools. Okay, so you could pick up the phone and call your 20-year-old self. What do you tell her?
Ooh, 20-year-old self. Oh man. What I wish don't marry him.
Yeah.
I'm kidding. Just kidding. My 20-year-old self. Maybe I would say things aren't going to go as planned, but things are going to go better than planned, because it is in the hard parts of life that you find your worth and your value, and you find the worth and value of being alive. Keep going. It's the process that's going to make your life meaningful, not the destination that you seek, right? So when I was 20, I was looking at a destination, and I missed the mark a little bit, because it's in the everyday, it's in the present moment, where you find meaning.
Yeah, absolutely. Yeah, very, very true. Okay, so you've got a billboard in Houston. What do you want written on that billboard?
Oh, a billboard in, oh, how fun. Oh man, that's so hard.
I know it is. It doesn't have to be OCD related if you don't want.
Okay. Is it to me, or is it to just the public?
It's for the masses to see. Yeah.
Masses. Well, can I go back to that? Can I go back to you can do hard things?
Yeah, of course.
Yeah.
Yeah.
Okay. Maybe you can do hard things. I really say that a lot too with my patients, of living a life in line with your values instead of your fears. So maybe something along those lines. Live a life of values. Doesn't sound. I'd have to think about this. Yeah. maybe you can do hard things for now. Okay,
let's do that. And then lastly, is there anything else that you wish you could have shared today?
I think we did a good job. I think that you touched on everything, and I shared maybe more than I thought I was going to, but I'm glad to. I always think that I always find that there is a reason that I have been compelled to share something, and so I just hope that it's helpful to somebody listening.
Cool. I have no doubt it will be. So thank you so much for your time today. I really appreciate your knowledge.
You're welcome. Thank you so much for having me. It's been so much fun, and to getting to know you too. I've only ever heard you. I've never
seen me.
Yeah.
So there you have it. Thank you so much for listening to this week's episode. Thank you to Ivy for her time and to you guys for listening. And don't forget, today's episode is sponsored by NoCD. To find out more about NoCD and their therapy plans, head to go.treatmyocd.com/the OCD stories or click the link in the episode description. Quick disclaimer, guys, this podcast is not therapy. It is not a replacement for therapy. Please seek treatment from a trained professional. Until we speak, take care.